Susan, thank you so much for joining us. We are really excited to talk a little bit more about your journey to selecting a prior auth vendor and what challenges you faced before deciding that a solution was needed. Can you just give us a quick little overview, just in case there's anybody that's joining us that doesn't know you or doesn't know your role?
Sure. Susan Sanchez, Cox HealthPlans in Springfield, Missouri. We have all kinds of lines of business, except for Medicaid. We've got Medicare Advantage, we've got Marketplace, commercial, self-funded, level funded, and still short-term. We'll see how long that stays because of the new administration, but we have all kinds of business lines ready to go for anybody in 21 counties. Not sure on the counties, but we are owned by the health system, Cox Health. So we're still provider owned and in great partnership with them, although sometimes that will hold us back just a little bit. And this is one of our implementation that holds us back just a little. And yeah, went searching for a new product line and settled with Itiliti. Not settled. We are with Itiliti.
That's very exciting and very exciting for us to be able to say that we're part of your.
Yeah, we're partners. Mhm.
Yes, that's so exciting. So, as you were considering solutions for prior auth challenges, what challenges kind of led you to decide that you needed a
Yep.
partner?
This was the hands down for us. So as I said, the health system is our partner, our biggest partner. They're our owners. They are moving from Cerner to Epic. So they're into a big 2-year implementation. I need to be up and live by 2027 as just like everybody else. They're not going to get to my integration, my EHR integration until mid 2026, which makes me nervous. We don't have an electronic solution. We sort of do. We'll tell on myself here. So the state of Missouri required us to have electronic prior authorization in place 2 years ago. Well, we hadn't seen the federal regulation, so I wasn't ready to move quickly on it. So what I did was fired up just a chat bot that is basically a form. The provider fills in the form, sends to us, member services screen scrapes it, sends it to medical. Very inefficient, but it met the goal. So when federal came down with their final ruling, now we're ready to start. We need to find a solution. Now, because our main provider, the health system, isn't ready for EHR integration, nor, well, I should back up. You guys are ready for EHR and also ready for a real electronic form for them to fill out at the provider office and send the electronic prior authorization that I will batch load into my system, which is QNext. You guys were the only ones that could give that to me. So it was a hands down, you win. Because I needed that. I didn't want a very expensive product. No matter where you're going to go, this is an expensive endeavor for any health plan. I didn't want that sitting on the shelf until my provider was ready for an EHR integration. I'm sitting there just waiting and waiting. I don't need that. I need quick integration up front for my medical department to receive some efficiencies for the product I have to have implemented by 2027. So that's why it became such an easy solution for us. Once Michael demoed that front end, that we could submit that way, we were in.
Another way to interpret what Susan is saying is that the ability to support prior auth submission via all channels, not
Yeah,
just
that's great.
EHR, is a critical element, right? Because as Susan described, as we wait for providers to come up to speed on EHR integration, there needs to be the ability to support prior auth through the website, through provider portals, and through EHR. And that ability to support that hybrid future is what's really critical.
Yeah, to that point, Michael, my rural clinics will never integrate EHR.
Mhm.
You know, they don't have the system. They're using fax machines still. So, like literally the big fax machines, not a fax server. So they have to have a solution as well.
So, as you evaluated those challenges and the different options in front of you, what criteria did you outline to determine how you would select a prior auth vendor?
Sure. It goes to Can they do multi-channels, as Michael had stated? EHR, because I have to meet the mandate. All three pieces of that federal mandate, can they meet it? Cost, of course, we're a 50,000 member lives plan. So cost, of course, is a big deal for us. I got to get the best deal, most efficiency, and hit the deadline that's given to us among, all other priorities that are going on in the company. So those are the three pieces. State of Missouri asked us to always do 3 vendor searches on any new implementation. We have a scorecard, and so we went after our 3. It's probably been easier if we would just go with our core system. QNX was Cognizant, but it wasn't the right solution for us. So sometimes you have to break away and find the right one, and Itiliti in this case was the right one.
As you looked at different vendors in the marketplace, did you find a difference in terms of, I guess there's 2 components, readiness today,
Mhm.
and then the other is the level of self-service versus like staffing that you need to
That's true.
from the vendor?
Yep, that was really important. We learned that in the process. I didn't know it at the time, but as you learn from your demos that you have, and Utility could show us, hey, if you send us your business rules, those pieces, those diagnoses that don't need an authorization, we're going to tell them up front that authorization will never come. I didn't realize that at the time because I just didn't really understand the process and what the power of the program could do. So that became one of the lines on the scorecard. Can they do this? And again, it was all about efficiency. How can we process quicker and smarter?
One thing that I find so interesting is that many plans evaluate based on what their current vendor partnerships can offer. And
Mhm.
what we've found is that a lot of those organizations have great products. Prior auth is such a niche solution, and they don't know what they don't know. And there
Yeah,
is a lot more complexity to creating a solution for the upcoming regulations and also for touchless prior auth in general. Um, and sometimes you do have to look beyond the existing platform that you're on, and kind of use that as a building block to make sure that you have
yeah,
the foundation in place. But then with this being such a specialty service, um, you need to go with, in my opinion, which is obviously biased, you need to go with a solution that's going to, that's already tested and has been implemented at scale within large payer organizations, and you know it's going to work, so that you don't have that worry that you're not going to hit that deadline or that you're not going to be fully operational before the deadline.
for
Was that
sure. And we're, as a health plan, being blasted with emails. Are you ready for this regulation and everything? And so some of them I reached out to because we needed our 3 vendors. And we get in middle of the demo, and it's like, really, on one of them, I can't remember the name of the vendor. It was a weird name. Um, we get in the middle of the demo. Oh, they only do it for pharmacy, pre-auth, no medical. Okay, that one gets an X. There were so many of those that we are getting ready. We're not fully live yet, but we would like to partner with you to be a beta tester or be, a partner of us to develop this. I don't have the time to help you develop, and there wasn't that much cost savings in the development. We would do a lot of heavy lifting. We just don't have the time. We have so many other things going on. So yeah, you just really have to evaluate everything around you, and then find your vendor. And
I
they're not ready. The people are going to say that they want to have a demo. They simply are still in development, and that makes me real nervous.
and did you find any any other vendors that were ready but had, and I'm not looking for names, but had differences in the ways that they deliver, and what was it about Itiliti Health's approach to delivery that was positive for you?
For sure, the 100% winner was that front end. I can go to the website, hit a link, go to our website, hit a link, and submit an electronic auth without having to do EHR integration. Everybody does EHR integration. it's hard to find anybody. I didn't find anybody. I've had promises, yes, we'll develop that front end. It's just not our priority now. You guys, hands down, you're ready. You demoed it, Michael. So we wanted part of that as well. That was hands down for us. I just can't leave an expensive product on the shelf waiting. And so it was an easy solution, a decision.
Yeah.
So thinking about what you just said with bandwidth, your team bandwidth, and you have competing priorities on your team, did that internal bandwidth, especially in terms of your IT team, impact the vendor that you selected for prior auth?
It's really going to be the medical team. We're going to take this opportunity to look at what we require an auth on, what we don't. It's time to look at our business rules from scratch. So right up front, the heavy lifting is going to be on my medical team, and then we'll take that into our QNext configuration and then outbound from there. So the heavy lift it up for our decision, and it may not be for everybody, but let's look at the business rules. We've not looked at them in years, so let's start from scratch again, decide what should and shouldn't be, and then clean up the system going forward. Probably a 1/1/26 going forward, auth-wise.
In terms of the implementation lift, um, were there issues or discussion items between the different vendors in the approach to implementation that were variances for you?
For sure, yeah. A lot of they just aren't ready for prime time yet. So on the IT side, there was going to be a lot of back and forth. I apologize for my phone ringing. There was going to be a lot of back and forth. Test this file or this file. Oh, that doesn't work. We're going to rewrite it now. So now I need this. So it'd be ever changing. What I'm looking for is here's the format. It's solidified. Can you do it? If not, okay, maybe some customization, but it's because we requested it, not the vendor. So yeah, it's just not ready for prime time, and that's going to be an impact on my team.
What do you envision for the future beyond just gaining compliance with the prior auth mandates? What do you envision for the future of this functionality for the health plan and also the provider teams that you work with?
Yeah, for sure. One of the things, we're outlining it now. One of the things that we receive so many faxes. I mean, so many faxes. I'm sure other health plans do as well. But we had a customer service rep, I believe is what they call it in medical, a person that would file this medical record and send out an email. So that got really heavy on time, no efficiency there whatsoever. So we fired up a robot to do it for us. Now, once we have the electronic auth, we're going to archive that robot and use it for something else, somewhere out there, claims or something. But we can down an entire robot, which is like 2 staff people, because we can now receive this authorization and only the authorizations that we need. Those no auth required, we're not even going to see them. We're seeing them now, and we're evaluating them, responding. It's not required. Those are out of it. So basically staff efficiency is where we're at, and a robot efficiency as well.
Do you envision a future for Cox Health Plan for nearly touchless prior auth? That's like always on my mind.
Yes, right. Yeah. Eventually, once they move from Cerner over to Epic, because Epic has so many efficiencies that they're going to win, it's going to flow right down to us. So yeah, it could very well happen that way. Now, I'm optimistic, of course, and pessimistic a bit too. I'll believe it when I see it, but right out of the gate, we're going to get some efficiencies just spinning this up. And another thing with the robot down, I pay per page on faxes because I have a fax server that I outsource. That fee is going to go down tremendously as well. Runs, about $2,000 a month. It's not that bad, but we could totally see that go down to $200 a month. And overall, savings is a savings. I'll take it.
Do you think that that Itiliti Health's ability to integrate directly with Epic also influenced your decision at all? I've
For
heard you
sure. Yeah.
mention the Epic
Mhm.
integration a few times.
Yeah. We did do our homework and we checked. It was told to us that yes, there's a Epic integration, but of course we got to do our homework, and it's there, and they're ready to work with us. I think they said May of 2026. So that's going to give us some really good, we're going to have some history with the product because we're starting implementation today. We have our first kickoff call um, at 3 o'clock. So we'll get it live. My medical team will kind of have a lot of practice in it and flows, and we can watch our workflow on our side. Then the next phase, mid next year, we'll go EHR and we can watch that phase workflow through and then kind of fine tune on both sides. But I like how we're going to phase this in because we're going to know the product so much better before we add that integration piece. So I'm excited.
Just want to clarify your May of next year is the Epic implementation within
Correct.
systems,
Mhm.
not the Itiliti Health Epic capability. So
Yeah, if another facility comes to me and says, "Hey, we want to start now," I'll totally listen to them and we'll reach out to you and say, "Hey, help me. I need another kickoff." But for now, we're just looking at the front end, enter it manually kind of thing. But sure, it could be anybody.
right.
I think one of the things that you guys have done really well is not just plan for the implementation, but also plan a pretty robust period for testing before before the mandates are officially in place. Do you think that that gives you peace of mind knowing that you're starting now and you have quite a bit of runway to get the full solution implemented, and then you have at least 6 months of testing once this is, I mean, if you're thinking about your Epic integration goes or your Epic platform goes live in May, that gives you at least 6 months of testing in 2026 to make sure all of the bugs are worked out before with
Yeah.
usability and all of those things before you're actually required to have all of these pieces in place.
Yeah, for sure on the integration part. But I'd also counter that I now have this product and I report up to Matt Ogg, the president of the company, and he will want to see some efficiencies a lot earlier than 2027. So to say we have a 6 month testing, I'll give you that for EHR stuff, but we've got to hit the ground running on the upfront efficiencies. I've kind of promised that.
Well, I think that that's fair. I think that we have a track record of producing significant efficiencies and
Right.
administrative savings for our customers in various different ways. And so I think you guys are well positioned for that.
I
Again,
think so.
I'm biased, but that's my personal opinion.
And I'm counting on it.
I think in general, what other payers want to know is why shouldn't I just wait? Aren't you assuming that the federal government's going to delay this criteria requirement and wouldn't we just be better off waiting as some of the payers are thinking, right? I'm curious what your thoughts are along those lines.
Yeah, I'm not going to wait. I need a solution now. This is the best thing for our company, efficiency wise, mandate wise, the full boat, right? So yeah, I could wait, and we do that on some of our federal mandates. But there's another piece to it that I need. Not just if they threw that out today, that's totally fine. I have an efficiency piece in place, or will start today at 3 o'clock, that can be used forward or carried forward into years and years with the EHR integration mandate or not. I will still integrate if I can. If they take the mandate down, that's just less pressure of I better do it by 1/1/27, but I want to do it by 1/1/27 either way. So that didn't come into play for us. It just made it finalized that we've got to move on this. And my little chatbot just doesn't work.
That makes sense.
I think a lot of payers are facing the same decision right now, and contemplating whether they wait or whether they don't. There was a study that we saw recently from Weedy that showed that a lot of payers have not taken the first steps towards selecting a vendor, or they're still really in that evaluation phase. And so I think just your insight and thoughts on this are so helpful to those that are still thinking about it and worried that they're investing a lot of money into a solution that, maybe they're not going to need. I think your point that
Yeah,
it's needed, whether or not there's a mandate, is so
it
true.
is for us.
Yeah, another discussion point is that there are not a tremendous amount of vendors that actually have delivered these kinds of technologies, and waiting puts you at risk of having to compete for vendor attention, right? Normally, vendors are coming at you right and left, but in a
Yeah.
year, and there's 6 months left, you've narrowed your population of potential vendors to only those that can deliver, and it might
Mhm.
be a small set. And not that you're a small company, but being a smaller company, you might have difficulty competing for the attention of the few vendors that are left that can actually deliver.
Yeah, that is a good point. Yep. And just to add kind of a plug for Michael, he came from a health plan.
Mhm.
So he knows the health plan. My other vendors are a software vendor that knows the mandate and maybe some structure and things like that. That was another piece that was a sell for us. Michael knows health plans. He used to be on the ground, boots
Yeah,
on the ground running with this. So that helped the decision as well. And I just remember that when you were talking about that, Michael, that's another huge advocate piece that need to be mentioned.
right. We appreciate that.
Mhm.
Probably not something we talk a lot about, actually, that you were with Blue Cross of Minnesota,
Yeah,
and that our solution was developed inside of Blue Cross of Minnesota
You know
based
that
on
that
needs. Yeah.
experience, that experience is a lot for a smaller business, and I don't take offense because we are a smaller business, but you know our ins and outs, you
yeah,
understand it. Whereas a software company, they don't, and they kind of lead us as opposed to us lead them, and a lot of times that's where you get in trouble with with implementations. Like, no, this doesn't work, and they're hard line. No, this is how it has to work. You guys change your business rules. You guys know my business rules, basically.
right, right.
Can I ask just one follow-up question about medical policy as we're kind of talking about your implementation? Are you excited about the medical policy organization and the access that your team will have with a medical policy database that's cloud-based that shows all of that history and allows you to make edits and track changes in real time?
Yeah, for sure. Um, that wasn't on my punt list, of course, because I'm not in that department, but it did come out by the medical manager. That was one of his like wins for the product. And we didn't see it in the other vendor solutions.
Mhm.
Well, your feedback is invaluable. We really appreciate it.
Oh,
And
sure.
that you were able to take the time to meet with us today. We know how busy you are. And so it's just so appreciated that you were willing to chat with us and share your experience and share some of your selection criteria, because I think that's so helpful for other plans that are in the same boat.
For sure. Anytime.
Thank
We can maybe spin up another one after we're live and we'll
Yeah.
talk about it some more.